Hello and welcome to the Physio channel. My name is Daniel Lawrence, and in this video I'm going to show you the 3 most effective ways to use cups or RockPods on the neck. The most traditional way to use the cups for neck pain involves attaching the cups, each with a negative vacuum, over the upper shoulders and lower neck. This traditional technique can then be enhanced by encouraging the patient to side flex their neck in both directions and also to rotate their neck, both against the passive resistance of the cups. In addition, you could then manipulate the soft tissue over specific areas by moving the cup around like so. A more specific application allows you to target a specific region or vertebral level. By securing the pod over the spinous process of a chosen cervical vertebrae, in this case we're choosing C7, the vertebra prominens. Once in place, the patient should be encouraged to rotate their neck into the restricted range of motion, whilst you assist that motion by bringing the pod around like so. So once again, for example, if they were rotating to the right, you would pull the pod over to the left in order to assist that rotation. Once they've met the end of range, what you can also do is manipulate the soft tissue at that end of range just by adding some extra stretch and shear force down through the soft tissues. And that can be repeated 2 to 3 times. If it's found to be beneficial, if it reduces pain with rotation, and if it helps increase range of motion, then you can repeat that for another 2 to 3 sets of 2 to 3 rotations. So I hope you're finding this video helpful. If you are, then please give it a thumbs up and consider sharing it. Finally, let me show you one of my favorite techniques. Now, you may struggle to get this to work for all of your patients due to the difficulty in getting the pod to suck up underneath the suboccipital ridge. But this technique is one that patients will really find great benefit from, especially those suffering from cervicogenic headaches. If you can't get a pod to sit here and to get some decent vacuum, then I'll also show another technique on the screen here and put a link at the end of the video to a more manual technique to get into that suboccipital space just using your fingers. But do try with one of the smaller pods, because if you can get some vacuum, you can perform a brilliant soft tissue treatment. There are some other technique videos showing on the screen here, and if you would like to learn more about cupping, then check out the course links in the description below. Thanks for watching. Hopefully you've subscribed by now, and I'll see you on screen again soon.